Gastrointestinal cancers are often thought of as disease of older adults, but in recent years we are seeing more and more patients in their 20s, 30s and 40s being diagnosed. In this video, I want to explain why this trend is happening, what risk factors are involved and what younger patients need to know. Hello, I'm Dr. Vivek, a GI Onco-Surgeon at the SSO Cancer Centre. I specialize in cancers of the stomach, colon, rectum, esophagus and other parts of the digestive system. Traditionally, most of these cancers were seen in people above 60. But today, younger patients are walking into a clinic with these diagnoses. This shift is important to understand, both for awareness and for early detection. There are several possible reasons. Lifestyle changes over the past few decades, diets higher in processed foods and red meat, lower fiber intake, rising obesity, sedentary habits, alcohol use, and smoking are all contributing factors. Environmental influences may also play a role, including exposure to chemicals, pollution, and stress. At the same time, chronic digestive conditions like inflammatory bowel disease, long-standing acid reflux are becoming more common, which can increase cancer risk even at younger ages. And finally, genetics cannot be ignored. Some cancer patients carry inherited mutations like Lynch syndrome or familial adenomatous polyposis, which significantly raise their lifetime cancer risk. One challenge is that younger people and sometimes their doctors may dismiss symptoms because cancer isn't expected at that age. For example, rectal bleeding may be blamed on piles, or persistent indigestion may be brushed off as acidity. This often delays diagnosis until the cancer is more advanced. That's why awareness is critical. If a young person has persistent symptoms like changes in bowel habits, unexplained bleeding, prolonged abdominal pain, weight loss, or difficulty swallowing, it should never be ignored. The good news is that younger patients, once diagnosed, are often able to tolerate surgery, chemotherapy, and other treatments compared to older patients. Their recovery can be smoother, and long-term outcomes can be very good if cancer is caught early. But treatment also has unique challenges. Younger patients are often concerned about fertility, body image, returning to work, and long-term side effects. These issues need to be openly addressed as part of their care plan. While not all cancers can be prevented, there are steps that younger people can take. Maintaining a healthy weight, eating a high-fiber diet with plenty of fruits and vegetables, limiting processed and red meat, reducing alcohol and tobacco, and staying physically active are all protective. For those with a family history of GI cancers, genetic counseling and earlier screening with colonoscopy may be recommended. Awareness of personal risk is key. The rise of GI cancers in younger patients is a reminder that cancer does not have an age limit. The most important takeaway is to pay attention to persistent digestive symptoms, no matter how young you are, and to seek medical advice early. With timely diagnosis and modern treatments, outcomes can be excellent. If you found this video useful, please share it. It may help another young patient recognize symptoms early. And do not forget to like, share, and subscribe for more patient-focused education on GI cancer care.